There's not a lot of places who do transplants.
Heart transplantation.
We transplanted the most people in Michigan.
If you or a loved one are in critical need of a heart transplant, she is the first person you will see.
So I'm the physician who identifies the patients who needs a transplant and takes care of the patient after the transplant.
For Women's History Month, we highlight a nationally known cardiologist from Henry Ford Hospital, Dr. Celeste Williams, a leading authority on advanced heart failure and transplants. She is tasked with leading the cardiac transplantation program, the largest in the state of Michigan. And of the 7 transplant cardiologists on her team, 5 are women.
Women in cardiology.
Cardiology is a predominantly male specialty. But I will say that the subspecialty of heart failure transplant, we have a very nice representation of women.
Dr. Celeste Williams is a transplant cardiologist at Henry Ford Hospital in Detroit, where she is the medical director of cardiac transplant and the director of quality at the hospital's Heart and Vascular Institute.
I think it's so important to have a diverse staff in race, ethnicity, age. It just changes how you treat your patients and the quality of care you give them. My focus is on access to care and equitable care for patients to ensure that we have standardized care, that people are getting the same treatment regardless of where they live or the economical status. It's a movement right now, and I'm very excited about it.
Dr. Williams' other hat as transplant cardiologist and medical director of cardiac transplant.
I see patients with end-stage heart failure who are getting ready to get a transplant or a left ventricular assist device, a mechanical heart. Medications don't work anymore. They have no surgical options. Although, yes, it's heart failure, I see hope. But what's so beautiful about heart failure transplant, the heart can be very forgiving. Patients can feel better. They can be with their families for longer.
Although Dr. Williams is not the heart surgeon, it is her expertise and direction that guides the decision to transplant. And it's one of the larger volume programs in the country.
We do between 30 to 35 transplants a year, and we have great outcomes. Our 1-year survival is excellent.
Outside of the hospital, Dr. Williams is a nationally known lecturer on advanced heart failure and leads preventative health care events throughout the community and her church.
Greater Grace Temple, where we do health fairs, where we have cooking class, really outreaching women, telling them about, risk factors for heart disease, how to prevent the end result of heart failure.
Speaking of women, Dr. Williams credits her college Alpha Kappa Alpha sorority sisters at the University of Iowa, who today are all doctors and one lawyer, for her ambition and drive to become a doctor. Along with a memorable childhood moment, pretending to be a nurse like her mother while playing with her siblings.
And my dad came up to me and said, "You should be a doctor. You're really smart." And I'm serious. I think I was like 4 years old. I always cared about people, but that's what sparked my interest in medicine.
And yet, despite so many women in the field, many of the doctors are still mistaken for nurses.
I've had those incidences that I'm not even, maybe even thought of as the doctor. And it takes people back, oh, she's the transplant cardiologist. And it's very common, actually.
When I asked this married mother of 2 adult sons, who in women's history is her role model?
My mother, she raised us with to be very independent women who had no limits. I'm the only one that can place limits on myself.
And that's her message to young women and girls.
And it doesn't matter if it's a role that historically has been for men versus women, but women are just as smart, just as hardworking. So don't limit yourself. You can do this.
Dr. Williams also talked about the impacts of the coronavirus on heart failure, not only damage that the virus can do on the heart, but how people are still avoiding going in for preventative care until their illnesses become so severe because they are scared of going to the hospital. So she expressed the hospital is safe and it is so important to maintain your health. So see your physicians.